I will.
I must pass NCLEX.
The nurses here that took the time out to do something incredibly brave, which was step out of your comfort zone. I just want to say, don't lose that fire, because the desire that you have to be a USRN is there for a reason. And we welcome you in the United States. I am so excited for your future, but you gotta make the journey. So hopefully you will connect with us so that we can help you. And as always, you can, you will, and you must pass NCLEX.
Hello, everyone. I am so excited to be your host on our first masterclass here online. Hi, everyone. I am here with my amazing partner. Yes, this is the NCLEX USRN Masterclass. Yes. And we have our entire team here to make sure that your pathway is sure, and that make sure that your pathway is going to be the most blessed and easiest way possible for you to make your dream come true. So I'm not here by myself. I also have your host as well. NCLEX Unlimited is in the house. Hello, Sir Gary, Ma'am Raj. How are you?
I'm Professor Regina. We're so good, and it's nice to be here once again for this amazing time with all the people listening and watching all over the world. We are so grateful for this time, and we are so excited to have this USRN Masterclass that we prepared for those students who were not able to attend our Philippine tour or nationwide caravan a couple of weeks ago in Baguio, Manila, Cebu, Cagayan de Oro, and Davao. So we are doing this since you missed those live sessions with Professor Regina. We are currently doing it right now, so we can also showcase to you what we can offer.
Wasn't it amazing the time and all the people that we met when we went around to the different cities? What was one thing that surprised you about the nurses who came out?
Well, for one, they were truly amazed about the partnership of having the best of both worlds, Philippines and USA. It's actually it was an historic event to
Yes.
collaborate with such an amazing partner in review provider in the United States to come along and in partnership with the Philippines. And looking upon the faces and the interactions of the nurses from Luzon, Visayas, and Mindanao, I could pretty say that they are truly grateful, and they are excited to participate and uh, uh, have our program as their uh, as their package for
Yeah.
their review program for NCLEX preparation.
Yes. Good evening, everyone joining. What we are talking about is that today is your opportunity to finally make the decision that you will move forward on your journey to becoming a USRN with our amazing team here to support you. Well, we're not going to keep you long this evening. We want to get right into our program. So we're going to offer you something that is honestly more important than anything that money can buy. We are going to offer a prayer. We are going to offer up, just an opportunity to see what the Lord can do when you put your trust in Him, So we're going to get into our program. I'm going to turn it over to the COO of NCLEX Unlimited. Such a wonderful spirit. And when I first met her, I was just like, wow, if I am able to have her poise, her kind spirit, her wisdom, her beauty. You ever meet somebody and they're like the total package? Well, that is Ma'am Ra. She is, and she'll actually be offering more information on how you can make your dreams come true today. So I'll introduce her. Everybody say welcome, ma'am Rajalyn, to the broadcast.
Yay.
Okay, this time, let's all pray. Heavenly Father, Lord Jesus, we come before you tonight with grateful hearts as we gather for online NCLEX Masterclass. We ask
Mhm.
for your guidance, wisdom, and clarity as we prepare to serve others through our nursing profession. Bless each participant with focus, understanding, and confidence. May your strength inspire us to learn diligently and grow in your skills. Grant us peace of mind and remind us that with your help, we can overcome challenges and achieve our goals. Thank
Amen.
you for the opportunity to learn and become better individuals. In Jesus' mighty name, amen.
Amen.
Amen. Amen. Amen. Amen. Wonderful prayer. One thing about us is guess what? We will never do anything without the Lord's blessing. So, everybody that is here tonight, you are not here by accident. You are supposed to be here. You're supposed to be here. Sir Gary, before I get started, I just want to say, is there anything you need to say to everybody? I know you got some information coming later on for them.
So yeah, I hope you're going to enjoy the time this evening with Professor Regina for the USRN Masterclass, and we're excited to be with you in this beautiful evening. So we will not take this for long, and then we will start right away. And then later, after Mom Regina, we will see you, and we will talk to you about the amazing packages that we can share with you.
Amazing. All right. That sounds like a plan. Sir Gary, he has helped many nurses come to the US. So he is the key to making sure that your steps are sure on this evening. So we'll hear back from him in just a little while. All right. All right. And for the rest of us, it's time. If you have your workbooks, go ahead and get them out. We are going to be diving into how you can critically think for NCLEX, how you should be studying. There is a right way and there is a wrong way to this process. Okay. So, everybody, if you're ready, put ready in the comments. If you're ready, put ready in the comments. And it's okay if you don't have your workbook. We're still going to roll. We're going to roll. So don't worry. Don't worry if you don't have your workbook. We are still going to roll. I see Anna saying she's ready. I see you guys saying that you're ready. Oh, this is good. This is good, 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 good. Okay. All right. Tap in. Tap in. All right. So here, I'm going to start with this. These are the hard truths, everybody. Okay. Now don't get mad. All right. Understand these truths. Let me also know where you're watching from, because this is important. All right, I'm speaking to my Filipino nurses here. This is the hard truth. Most Filipino nurses waste 6 months to 2 years studying the wrong way before finally passing, or this, giving up. Okay. Sadly, most Filipino nurses wait 6 months to 2 years studying the wrong way before finally passing or giving up. And I don't want you to be in that number. Okay. I don't want you to do it the wrong way. Now, another thing is this: when we talk about international nurses, all right, thousands of Filipino nurses apply for US jobs every year, but almost 50% fail the NCLEX on their first try. Almost 50% fail the NCLEX on their first try. Now, there are so many reasons why that happens. Okay, there's so many reasons why that happens. But what I know and I understand is that it is not a matter of education. The NCLEX is not testing how great of a nurse you are. It is testing your critical thinking. It's testing your critical thinking, which is different. It shows up differently. So when we talk about what we need to do, we need to address critical thinking for international nurses. All right. And critical thinking, just by definition, how many people know what critical thinking is? If somebody asked you, what is critical thinking, what would you say? It's your ability to analyze clinical information, evaluate outcomes, and make the best decision for patient care. That's it. You're either ready to do this or you're not ready to do this. And let's just start by jumping in with this very, very, very basic question. Which patient should the nurse see first? The patient with hyperglycemia or the patient with hypoglycemia? Put it in the comments. I want to see how you are thinking, how you're prepared for critical thinking. Who's the patient that you're going to go to first? The patient with hyper or the patient with hypo? I see Manila's here. I see CDO in the house. Pazak City. I didn't make it there. I'm so glad you're here. Okay. Lots of B's, lots of B's. Okay. I think we might be right. Some people are saying A though. Okay. All right. So the correct answer is B, the patient with hypoglycemia. Patient with hypoglycemia. Why is that? Critically think this patient is going to get worse faster. That's it. Those signs of hypoglycemia quickly can turn into seizure, death, coma faster. And so this is critical thinking. It's just analyzing what you know and then applying it to a real life scenario. That's what NCLEX is going to do. Shout out to everybody who got that right. Not bad, everybody. Okay, so how do we improve our critical thinking? Because honestly, that was an easy question. So in order to improve critical thinking for international nurses, you have to master facts first. You cannot think about something that you don't know. So you must know the material. And it's not a difficult thing to do. It requires programming, it requires training. And so tonight, with our partnership, not only do we have the best of ReMar that we are offering for you, but we also have the best of what NCLEX Unlimited has to offer. So both of our programs, both of our technologies together to make sure that all of your bases are covered. There's a lot of knowledge that you need to review so that you're able to critically think, okay? That you're able to critically think. All right. Marley says, can anyone help me find a good agency to process my USRN visa? I am so glad that you're here because we are going to help you to process that USRN visa. Yes, we can help you. Okay, now let's go back to our training here. So we got to master the facts first. We also always ask why. We have to be able to ask good questions, not just accept an answer, but also question, why is it correct? Okay, why is it correct and what other options are available? Can we do that? Yes, we can. We can absolutely do that. And then another thing is we have to recognize what is most what? What is most critical? What is most critical? All right. In real patient care, everything can feel important, but only some things are life-threatening. So we have to learn to separate important from critical. Now, I'm going to challenge everybody. Hey, if you need help processing your visa, or if you need help getting the ReMar packages, right now, put it in the chat so that we know that you need help. You don't have to wait to the end right now. Any questions that you have about your visa processing, or how you're going to get the ReMar package or the NCLEX Unlimited training, I want you to ask early and often, because that is one of the reasons why we're here, so that we can provide you live, on the ground, online support to make sure that you're getting this information. Because guess what? NCLEX processing got it. We got it. And we're going to do it the right way, where you get control over how things go. All right. We are going to prioritize everyone who is in our program. So I want to see those questions in the comments. All right. Let's get back to it. Also, we have to learn to separate important from critical. So what does that mean? Professor Regina, what are you talking about? What's the difference between important from critical? Important from critical. So we have some things that are important, and we have some things that are critical. What's the difference? Hey, what's the difference? So if you are thinking about important things, well, an important thing that is good to note, but you're not running to it, is going to be single vital sign changes. Okay, single vital sign changes. Waiting for diagnostic test results. Patients who are waiting for diagnostic test results. And most electrolyte imbalances. Okay. And again, these are things that are important, but you're not running to these patients, especially on NCLEX. And definitely expected pain. All right. These are things that are going to be important, but not critical. All right. So the gamer says, hey, I need help to get the ReMar Quick Facts and V2 books. Well, yes, right now, if you are in the Philippines and you need to get the ReMar books, the ReMar packages, there is a website at the bottom of this page, remarnurse.com/PH. And that website will allow you to get all the information that you need in order to get your packages, okay? Our partners, NCLEX Unlimited, has them right there for you, okay? What about this one? This is a good one too. Do you accept credit cards for the payments to avail the package? Yes, we do. Yes, we do. Good questions. All right. Though we talked about important, let's talk about critical. Now, these are the things that you do want to look out for. That is multiple vital sign changes. That's a patient who would be a priority on NCLEX. Changes in LOC, or level of consciousness. Also, very important. And then time-sensitive conditions. Time-sensitive conditions that are critical are going to be allergic reactions like anaphylaxis, sepsis, or shock. And again, these conditions, your patient has a very short window of time to maintain their own airway, to maintain their own blood pressure or heart rate. And so you have to do something. Again, the website for tonight is remarnurse.com/PH. Tap in there. We're getting you prepared for NCLEX in less than the time it takes for you to pack your bags and fly to the US. Okay. We're making sure you get there fast. All right. Let's try this question here. In the comments, I want to see it. I'm asking, which patient should the nurse see first? Is it a diabetic client with hot, dry skin, or a diabetic client who is sweaty and shaky? Who are you going to first? Are you going to A, or are you going to B? And this is the way that you're going to challenge yourself and evaluate yourself. I see a lot of B's. Is that your answer too? Are you picking B for this patient as your priority? If you pick B, I think that you got the right answer as well. So again, what I did here, I just asked you the same question in a different way. So we know that sweaty and shaky are also signs of hypoglycemia, which requires immediate treatment. So the patient whose skin is hot and dry, okay, nurses know this, this indicates high blood sugar. Hyperglycemia, which you already have established, is less emergent than low blood sugar, okay? Hey, how about this one? Let's switch it up a bit. Which patient should the nurse see first? This is electrolytes. Is it going to be a client with a low potassium of 3.0 or a client with a potassium of 6.3? I'm looking for the first person who puts the correct answer in the chat. Is it going to be A or B? Quickly, because one of the things about NCLEX, you don't have all day. You actually just have 5 hours, which may seem like a long time, but I know people who run out of time on the NCLEX, and it is because they are second guessing. Wow. Correct answer here is B. Is the client with a potassium of 6.3. Yes, okay. So we know that somebody had posted this too, and this is one of the reasons why I love our study groups. Potassium of 6.3 can be considered a deadly rhythm, Okay, so we need to make sure that we are able to, boom, yeah, get that patient on the right track. Okay, I'm moving on. So as we are attempting to increase our critical thinking, what we need to be doing is practicing those unfolding, computerized case studies. Reading content alone is not enough. Unfortunately, I'm sorry, it's not enough. You have to be in those case studies. You have to be answering higher level application questions. What we did is just the baseline. You have to be able to take it to the next level. So in the question bank that you will be getting with our package, we have unfolding case studies. Okay, so in the ReMar Q Bank, there are about 80 case studies for you. Okay, so if there are 3 things that I want to tell you to do: review the videos, do the quick facts book, and do the Q bank. Those are the 3. You need to have all those things together in order to learn the quickest and the fastest, because we're not only working on critical thinking, but we also need to work on clinical reasoning. These are both essential in nursing, but they serve different purposes. So what's the difference? When we talk about critical thinking, this is something that you do in every area of your life. So you have to critically think: am I going to exercise in the morning, or am I going to wait until the evening to do it? Is it better for me to eat this for breakfast or eat that for breakfast? So critical thinking is something that we talk about a lot, but it doesn't always apply to nursing. Okay, so it involves analyzing, questioning, making sense of information. You can critically think about your credit card statements or your children's education. But it does help nurses to evaluate, research, prioritize, and solve problems. Okay, so if you're comparing treatments, that's critical thinking. Clinical reasoning is something that is specific to patient care. And I'm so happy that Nona says, I just got my ReMar and NCLEX Unlimited package. I am really excited. Welcome to the family, and all the best on the start of your program. Getting started is often the hardest step. It is often the most difficult for people to go ahead, commit to it, make that purchase, and get the package. So many people are celebrating you. All of Team ReMar, all of NCLEX Unlimited, we are so excited for you. Yes. So let me get back into it. And so clinical reasoning, this is going to help nurses to assess and diagnose and decide what is the best intervention. And that's very different than just critical thinking. Okay, so we're talking about how do you recognize early signs of a stroke and take action. That's something that is specific to clinical reasoning. And you know what? When I did this class, I was hoping that I would be able to get through it, but you guys just keep coming on here with great news. I may not be able to finish my lecture today. I got to say, hey, Richardson is officially a RN, a USRN. Says, thank you, ReMar. And that is the goal for everyone watching here. Almost 200 people watching. Do me a favor and go ahead and share this video so that others may know that we have a live class going on right now. So congratulations to you. I want to see more questions in the comments. We're talking about this. So critical thinking comes first. If you're wondering what's the difference between critical thinking and clinical reasoning, well, critical thinking comes first because it helps the nurse know what is happening, what is going on, and deciding what matters. Okay. And without it, you're not really able to make decisions based on the best information. If the information that you are gathering is wrong, if you have missed the important points, then you're not going to be able to pick the right answer. So we want to have both. We want to make sure that if you're studying with us, you can always pick the right answer. All right. Now remember, why critical thinking comes first is because you have to analyze what's happening correctly, identify what matters most in patient conditions, and then make safe and effective decisions. Okay. All right. And that's the goal. That's what we want to do. NCLEX is a test about safety. You cannot pass NCLEX if you are not safe, So how do we be safe? We have to review the information before we can practice the information. So one of the videos that we have for you this evening, and it comes from the V2 package, is going to be total parenteral nutrition. And I believe that we're able to load this video up, and it will be one of the major topics that you need to review before you sit down for your license exam. Now, let me tell you a secret. You don't have to know everything in order to pass NCLEX. Actually, what I'm learning is that there are very few topics that you have to know about, but those few topics you absolutely have to have mastered. So total parenteral nutrition is one of those topics. It's one of them. And it is included in our review today. So we will be watching that video in 5, 4, 3, 2, 1. Let's play the video.
Total parenteral nutrition. Let's get into it. With TPN, this is actually a method of feeding that bypasses the gastrointestinal tract. So the way that we feed this client, we don't involve the stomach, the intestines, any of that, because we're using a special formula. So some may ask, Regina, how is this done? Well, what are the nutrients going through? They're going through the veins. They're actually going through the veins. So when nutrition goes through the veins, whose job is it to process that nutrition? What organ is now responsible for providing nutrition, right? Do you guys know? It is the liver. So the liver metabolizes the formula, and then the body is able to receive it that way. So This is a very complex intervention. It is not given to everyone. Who needs TPN? The client whose GI tract is not functioning correctly. They need TPN. So these are clients that have issues with their bowels or their stomach. So for example, ulcerative colitis patients, patients with Crohn's disease, right? Where they need a real intervention in order to prevent malnutrition, because that's the goal of TPN. We don't want our patients to become malnourished, so we have to feed them this way. Now, NCLEX may give you a scenario where you have a pregnant woman and she's really nauseated, she's vomiting all the time, and they will ask, is TPN a good solution for this patient? What is your answer? No, absolutely not, because the condition is pregnancy. There's nothing wrong with the gastrointestinal tract. NCLEX may give you another example where they say you have a client and they have stage 4 cancer, they're getting chemotherapy, they're terminal, the cancer's in the lungs, the chemotherapy is causing them to be nauseated, they have ulcers all around their mouth. Do they need TPN? What's the answer? The answer is no, these patients don't need TPN. There's other ways we can feed a client if they're nauseated, if they have ulcers. We can put down an NG tube, right? And still use that gastrointestinal tract because it's normal. So the reason why we don't want to give TPN is because when the liver begins to metabolize food, it causes a great strain on the liver, and your client will start to experience some liver failure within a few weeks. So this is something that's reserved for severe cases. When you're given TPN, what labs do you want to monitor? Well, you want to monitor the blood glucose levels, because TPN is mostly made of what substance? It's mostly made of dextrose. And dextrose, a lot of glucose. It's all sugar. So what is it going to do to the blood glucose levels? Is it going to raise or lower them? It's going to absolutely raise the blood glucose levels. So clients on TPN have their blood sugar monitored every 4 to 6 hours. You're going to go around and check it. What electrolyte imbalances can TPN cause? These are the ones that I want you to know. Hyperkalemia, hypermagnesemia, and hyperphosphatemia. And this usually happens in the beginning because normally TPN has nutrition and electrolytes inside the formula. And so the body has to adjust to receiving nutrition in this way. Oh, if your TPN runs out, what is the emergency substitute for TPN? That is 10% dextrose. Yes, you never want to abruptly stop TPN. You always want to gradually taper it off. TPN should always be given on a pump, and 10% dextrose is your emergency substitute. I hope you guys feel a lot better about this topic of TPN. I hope you know who you can give it to, who you can't give it to. What is your emergency substitute? And how do we wean a patient off of TPN? We do it gradually. You are ready to move on to the next subject.
Oh, right. As you just saw, that was one of the lectures from the V2 program, TPN. And you know what? Now it's time that we did the content from ReMar VT. It's time to go into the Q Bank, which is part of the process to success. You know, with our package, you're going to end up getting over 10,000 practice questions. And so if you're somebody who really likes to challenge your practice questions, this is a great opportunity for you to get 2-for-1 Q Bank for the NCLEX prep. So let's go into the ReMar V2 QBank practice questions on TPN. The first question is, okay, the first question, and again, these questions are going to be based off of the subject that you just reviewed. So if you're an audio-visual learner, this is the best way to prepare so that you're hearing the information, you're seeing that, and then you are able to practice. How many people in here are audio-visual learners? I know I am. I want it explained to me, and I also am somebody with a short attention span, so I want it explained to me very quickly too, all right? And that's what we do here. Here's our first question. A nurse is preparing to administer TPN via a central venous catheter. Which intervention is most critical to ensure client safety during administration? Okay. Is it number one? We're talking about safety here. Change the TPN tubing and filter, okay, to ensure client safety. 2, all right, change the TPN filter every 24 hours to reduce the risk of infection. 2, check for bowel sounds prior to initiating TPN to ensure gastrointestinal readiness. 3, use a 22 gauge needle and flush with heparin before connecting the TPN tubing. Or 4, prepare the infusion pump to deliver TPN at the prescribed rate using an inline filter. What saith you on this evening? The answer is clear as day. Okay, the answer is clear as day. The correct answer is number 4. Yep, number 4. If you picked it, guess what? You were right, because TPN is one of those high risk therapies. And so you need to know that the most important thing for safety, okay, is to make sure that the patient is getting the amount they're supposed to be getting. Okay, that is the correct answer. And so if you didn't pick number 4, then you need to go back and review this information again, or you need to continue to work our questions in order for you to see the safety principles here. I'm going to do another question. It's this one. A client receiving TPN through a central line suddenly becomes restless and reports chest pain and exhibits shortness of breath. The nurse suspects an air embolism. Which of the following actions should the nurse do first? Number 1, stop the TPN infusion to prevent further airway entry into the circulation. 2, place the client in a left lateral Trendelenburg position to trap air in the right atrium. 3, administer 100% oxygen via a non-rebreather mask to improve oxygenation. 4, notify the healthcare provider to prepare for emergency intervention. Which one are we going to do here? And what I'm doing now is I'm demonstrating the need for training, because just because you're working as a nurse, just because you've been through nursing school, does not guarantee you success on the NCLEX. I see a lot of 1s. I see some 2s. What else do we have? I see some 4s. The correct answer here is number 2. Place the client in a left lateral Trendelenburg position to trap the air. Okay? And again, this question is not difficult, and it is not critical thinking. This is a safety question. So if you're getting these questions wrong, you're not prepared. You're not prepared. But guess what? There's good news. You are at the right place to get your training. Okay? And this is the opportunity that we're putting in front of you. Question number 3. Here we go. A client on TPN has a fever, has chills, and increased heart rate. The nurse inspects the central line site and notes which nursing action. So if a patient has fever, chills, and increased heart rate, the nurse is looking at the central line site. What should that nurse do? Is it number one, remove the central line immediately? 2, notify the healthcare provider and obtain a blood culture. 3, flush the line with normal saline to check for resistance. Or 4, administer acetaminophen and monitor the client. What are you going to do? Okay, we're asking what is the best thing to do? Correct answer is number 2. Number 2 right here, notify the healthcare provider and obtain a blood culture. Notify the healthcare provider and obtain a blood culture. Oh, this class is so good. I could just keep going. I got to be mindful of the time, though. I got to be mindful of the time. What do I have up next? The subject of prioritization. Okay. And so what we're doing tonight, we're hitting the big topics and we're trying to introduce to you our process. Now, this class is not the entire training. This class is how to get started with that training. So we do have to talk about things that will absolutely be on your exam. Prioritization is one of them. So I'm going to give you one of the ways that I like to address prioritization. Okay, let's just start by doing this question together. I want to see your answers in the comments. So here it is. A new nurse working in the emergency room, right, reports for duty. 4 clients arrive at the same time. Who should she see first? Is it number 1, the 44-year-old male diagnosed with a DVT who is complaining of left leg pain? 9 out of 10. 2, a 3-year-old child with a fever, drooling, and is complaining of a sore throat. The mother says that the child is teething. What about 3, 8-year-old abused child? 8-year-old abused child, bruises around the ear and a gunshot wound to the left lower extremity. Oh my goodness. Okay. 4, 25-year-old female, okay, blood glucose of 425, who has frequent urination, thirst, and increased weight loss. We got a lot of things going on here. Lots of things, lots of different people. Let me see what the consensus says here. Oh, I can just tell by the answers being all over the place that prioritization is something that we need to make sure we are training on. We need to make sure we are training on this subject. Okay. And thank everybody for participating. I know it's difficult showing up and then you got to participate, but you're doing it. So I don't want to give the answer just yet. I want to go over some basic principles here. Don't let NCLEX distract you with age or gender. Okay. So I'm teaching this principle and I don't want you, as we're doing these questions, don't let NCLEX distract you with age or gender. So it really doesn't matter how old the patient is or if they're male or female. Only think about what's happening. Check this out right now. Only think about what's happening right now. Now, look for the client who's going to what? Look for the client who is going to die first. Okay. And no, it doesn't sound good, but this is the way that we want to address. This is the way that we want to address our priority patient. Who is the most critical? Okay. Who is the most critical? Who has the least amount of time? So if we're going back to our original scenario, we have 4 patients who are coming in. You have patient number 1, 44-year-old male, diagnosed with a DVT, okay? And he has pain. He has 9 out of 10 pain. Now, this patient has a blood clot. Is that a serious condition? Yeah, it's a serious condition. But what is happening right now with the patient? Because the most serious condition with the blood clot is a what? It's that blood clot traveling. And traveling to where? Traveling to the lungs. That's something that we would be worried about. So we have to evaluate, is that what is going on here? Are we dealing with a traveling blood clot? Or are we dealing with what is in front of us? Okay, because it's very easy for us to go off into our minds and think, oh my goodness, this DVT could turn into a PE and that is an emergency. But that's not what it says. What does it say? It says the patient has a DVT and they're just reporting leg pain. So we're looking at leg pain. Is this our priority patient? No, 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 no. All right, let's go down to number 4. Number 4 says, because some people did pick number 4, and I can see why. Number 4 is a 25-year-old female. They have a blood glucose level of 425. That's high, all right? And they also have frequent urination, thirst, and increased weight loss. Now, this patient may be at risk for, some complications. However, when we think about somebody with uncontrolled diabetes and these symptoms, how long do they live? How long can you live with these symptoms? You can live quite a long time. And we don't have any issues right now of any other hemodynamic instability. So this is not our patient. Unfortunately, 4 is not it. Let's go up to 3. Many people pick 3. Well, with 3, this patient has a lot going on. They're 8 years old, abused child, bruises around the ears, okay? And a gunshot wound to the left lower extremity. So I would ask, is this an airway, breathing, or circulation problem? Airway, breathing, or circulation? Put it in the comments. So this is definitely going to be where we have a circulation issue. We have a circulation issue. So that's something that we need to be mindful of for our patients. Okay. Now, circulation issues, not great. Not great at all. But we have to look at number 2. I didn't go over number 2. Number 2 is a 3-year-old child with fever, drooling, and complaining of a sore throat, whose mother is stating, this child is teething. This child is teething. So we have to look at number 2 and say, well, this child is 3 years old. Do children who are 3 years old teethe? No, they don't. There's something else going on with this patient. They have a fever, okay? They're drooling. If you're drooling, that means you're not swallowing. That means you have a closed airway. Yes, this is epiglottitis. So we cannot have an airway issue, right? Because that patient has less time than anybody else. Even number 3, and number 3 is pretty bad. So the correct answer, the priority answer here is number 2. So I love doing prioritization questions. They're one of my favorite types of questions to do. I hope that we will get to do many, many more questions like this today and also in your training. So if you love to study prioritization questions because they challenge you, then you're going to be prepared for the NCLEX if you're doing questions like this. So this is the level and above of how we want to be doing prioritization questions. Anything other than questions like this, too easy. All right, so we're about the training. Let's train. How about this question? I'll give you a moment to do it. Let me read it to you. It's this. The nurse receives the following clients on a medical surgical unit after shift change. Which client should the nurse see first? Which client should the nurse see first? Is it number 1, a 68-year-old with pneumonia reporting chills and coughing up rust-colored sputum? Okay. Also, or a 75-year-old post-stroke patient with unilateral weakness who is coughing during meals. 3, a 40-year-old client with cholecystitis who reports 7 out of 10 right upper quadrant pain after lunch. Or a 55-year-old diabetic client with a foot ulcer whose blood glucose level is 210. Wow, 210. So, who do we have here? Who's our priority here? I think now we are a little bit more confident. I think we are doing a little bit better here. Very good, very good. Correct answer. I see it already. You got it if you picked 2. You got it. You got it. 75-year-old post-stroke patient, unilateral weakness, and they're coughing during meals. So yes, 2 is also an airway issue. Okay. 2 is also an airway issue. All right. So now just really quickly, what I want to do is just do like a rapid fire. I'm going to put 2 patients in front of you. Just go ahead and tell me, is it A or is it B? Is it A or is it B for this scenario? So here we go. First one is, who should the nurse see first? Let's go. Let's go. The client with a cut to the arm bleeding profusely, or B, the client with a blood pressure of 89/60. Who should the nurse see first? What do you say? What do you say? You got to say what? A or B? A or B? Let's go. Let's go. Let's go. All right. I see A. I see B. I see A. I see B. Correct answer is going to be, you'll be happy to know this, it's going to be B. It's going to be B. Yes. Good job. Good job. All right. Correct answer B. The client with a blood pressure of 89/60. This is a systemic issue. So we want to make sure that we are not allowing this patient to rock out here. All right. What about 2? A is a client presenting with sudden confusion, left-sided weakness, slurred speech starting 45 minutes ago. Or B, a client with chest pain starting 2 hours ago, radiating to the left arm. Who is the priority, A or B? A or B? What do you say? Okay, correct answer. Correct answer is going to be, let me see. B, client with the chest pain who started 2 hours ago, radiating to the left arm. Okay, radiating to left arm. I think some people got that one. Number 3 is this. A client with suspected appendicitis reporting right lower quadrant pain, 7 out of 10, nausea and rebound tenderness on palpation. Or B, a client with a bowel obstruction reporting severe abdominal distension and vomiting green bile. Who is the priority here? Who do you say is the priority here? A or B? Bring it in. Okay. Correct answer is going to be absolutely B. Yes, the client with the bowel obstruction. This is going to be our priority. Oh man, what about this? A client with 20% second-degree burns on the chest and arms. Or B, a client with an open fracture of the tibia, actively bleeding from the wound with a heart rate, with a heart rate of 130 and a blood pressure of 88/60. Now, this is interesting to me. This is very interesting to me. I want you guys to think about this. Who is the priority here? Okay, who's the priority here? There's a lot of going on, but I don't want you to miss it, okay? I don't want you to miss it. Correct answer here is going to be Number 4, yeah, it's going to be number 4, okay? Number 4 is A, is going to be the person with second-degree burns on the chest and the arms. And I know this is one that's very difficult for people to see, but you got to be able to see the respiratory issue there. Yeah, there's a respiratory problem there. Okay, I got to go on. 5 is a client with diarrhea, or B, a client with acute pain from renal stones. A or B here? You should be looking at this diarrhea as a significant issue, water loss here. So that answer is going to be A, the client with diarrhea. That's fluid loss. Can't miss that. Can't miss that one. Okay, number 6 is this. You have a client with a fever of 103 degrees Fahrenheit and a suspected infection at their IV site, or a client with a history of falls found wandering the hallway without assistance. Who's the priority right here, right now? Okay, who's the priority right here, right now? Correct answer is, boom, client with a fever of 103. Yeah, client with a fever of 103 and a suspected infection at their IV site. That's an issue. That's a big issue. So we need to do something about it. Okay, I see you guys tracking with me. Number 7 is this, is we are doing more prioritization. 7, are we going to prioritize A, client, which is a client with anorexia nervosa who has not consumed anything in 48 hours and is exhibiting weakness, or B, a client with mania who has been awake for 48 hours and is requesting a sedative to help them sleep? Who is our priority? Who is our priority here? In this scenario, I see Kim is saying it's B. I see Kim is saying it's B. Correct answer actually is A. It's A, and that's all right, because guess what? We are here to learn. If we knew everything, oh my goodness, if we knew everything, then we wouldn't need to learn it. Wouldn't need to learn it. All right. 8. A is a client who feels isolated and has requested a family meeting for emotional support. Or B, a client who is seeking spiritual counseling. They're seeking spiritual counseling as they need to find a deeper meaning in life. Yeah, this one was kind of easy. Correct answer here is absolutely A. I see it in the comments. Okay. All right. Now, we are going to get into, one of the things that are really, we don't have a lot of time to do this. Okay, we don't have a lot of time to do this, so we got to move quickly, but we do need to do a patient simulation. So I'm going to try, if you don't have your workbook, I'm going to try to take you into it. But you're going to have to remember these details or try to quickly write it down. So if you're having a good time studying, this is what we do. Okay, this is how we study. Also, I go live every Monday at 12 p.m. Eastern time, and I go live also every Wednesday at 9 p.m. Eastern Standard Time, and we do things like this. So write that down. Mondays and Wednesdays, I am requesting that you come to our study sessions, okay? And somebody who knows our study sessions, put them in the comments. Okay. All right. So we're going to go into a patient simulation, and I'm about to give you information about your patient that you need to know. So here is your patient, right? You are going to be taking care of Mr. Juan de la Cruz, okay? He is a 65-year-old male. His diagnosis is pneumonia, diabetes, hypertension. He has an admission date of March the 8th, 2025. He is allergic to penicillin. He has a code status of DNR-CC, and his healthcare provider is Dr. Reyes, okay? His insurance is also Phil Health, insurance. So this is somebody that you are able to take care of. You understand the diagnosis there. You have the information there that you need to take care of him. Now, since we're doing case studies, they like to give you more information than just general. So we have an active problem list, and our patient's problem list is pneumonia, type 1 diabetes, and also hypertension. So that's also good to know, okay? Let's look at the vital signs. Is your patient stable? Are they good? We have a blood pressure of 160/90, heart rate 102. Also, we have, what else do we have? We have respirations of 26. We have a temperature of 38.4. The oxygen, okay, the oxygen of this patient is 88% on room air, and the glucose is 290. Okay, all these things considered. Did you write this down? Now, what's interesting is that the nurse's note says this, that patient is currently stable, no signs of distress, no immediate interventions required. So what? All right. Do we agree with this? Is this a good recommendation? How are we feeling about this? Okay. Let's look at the medications. So patient's on metformin. Patient is on lisinopril. Are you familiar with these medications? Patients on ceftriaxone. Patients on glipizide and warfarin as well. Okay. So just by the medications, you should be looking at, what is the medication for? Do I know what it's for? And also, am I able to treat my patient based on this? How about that? All right. Now, let's go on to questions. Okay, are you guys with me? Let's go on to questions. Now, which assessment finding requires immediate attention? Which assessment finding of our patient requires immediate attention? What do you say? I see the answers on the screen, and I agree. Okay, that oxygenation of the patient is too low, 88% on room air. That oxygenation of the patient, way too low. Now, knowing that, oh, you know what? I just realized that I did not look at my agenda, and I just rolled into the next section. And this actually was time. We'll do some questions and then we'll come back to the simulation, because I do want to make sure, let me see, and I did it right. I do want to make sure that I am giving the most valuable information at the appropriate time. Okay, so what I'm going to do is we are going to get back into our patient simulation. I'm going to do one more question, and then I want to actually, before I get too far ahead of myself, I want to open it up to the discussion about the visa processing, because a lot of you want to know about it. You are you're asking questions. You want to know how it all works, and so we have our partners here to make sure that the majority of you hear that information while you are yet here. Okay, while you're yet here. So let's do one more question about our patient, Mr. Juan de la Cruz, and then we'll go into talking about the visa processing. Okay, so the nurse is monitoring for complications of uncontrolled diabetes. Which finding is most concerning? Is it going to be, okay, we're talking about uncontrolled diabetes. Is it going to be A, the patient reports excessive thirst? Is it going to be B, a blood glucose of 290? Is it going to be C, fruity breath, rapid and deep respirations? Okay. Or is it going to be D, dry skin and delayed wound healing? Which one is it going to be here? Okay. Which one is it going to be? A, B, C, or D? A, B, C, or D? Okay. I see the answers on the screen. I see C here. And actually, I'm going to ask my partners if they have a PowerPoint for their visa processing to pull that up. Pull that up because I want to make sure that I have their information too. And I don't know if I have it here. Okay. So if there's a PowerPoint for visa processing that you guys want to have that you want to share, let me add my layout here. Okay. Then we will make sure that we will get that up if you have one or if you want to share one too. Okay. And it looks like I dropped off of my PowerPoint. Let me see if I can pull it up too here. Slides. 1 second, guys. My PowerPoint dropped off. Sometimes that can happen. And I see you guys have the right answer. Sometimes that can happen when you have so many slides. So we'll just get it up here. Let's see if I have it on here. Getting that up for you right now. Adding slides to. Okay, got all kind of slides going. Okay. All right, let's see here. Came up on me. Let's see here. Okay, so we were right at this question here. And I asked you for the answer. You gave me that great answer. I did see C. Oh, wait. Where'd it go? It's coming in. Okay. So it was there. Okay. Correct answer is C. That is going to be the right answer for this case study. Okay. All right. So actually, the way that things are going, I think I better just go ahead and finish this case study because we can break into the rest of the great information in a little bit. But let me go ahead and finish this case study. And I hope that's okay with my partners because I see we got some things going on with the PowerPoint. All right. My next question about this case study is, which medication should the nurse give at 9 p.m.? Which medication should the nurse give at 9 p.m.? Do you remember what the medications are? Let me see if I can go back and look at the medication list. Here it is. Here's the medication list. So which medication should the nurse give at 9 p.m.? What do you say here? There's metformin, there's lisinopril, there's ceftriaxone, glipizide, warfarin. So what NCLEX is trying to do is trying to see how you think about safety, how you think about information. Also, basically, can you read as well? Are you able to read something? Yeah, that's the challenge. So let me see the comments on the screen here. Okay, and I'm going to go back down to that question here. Which medications would you give at 9 p.m.? All right, let's see. Okay, I'm skipping that because there's something I'm going to roll back into. Okay, so I have a question here about this also. Does anybody know what's going on with the patient? Does anybody know what is going on with this patient? Okay, because the next question I asked is, which medication should the nurse request an order for? That's not there. So I put oxygen, but there's something else that this patient should be receiving that they are not receiving. Does anybody figure out what it is just yet? Do you know? Do you know? Okay. See where it said, okay, they were going to give them metformin. They're going to give them metformin. Cool, cool, cool. All right. Okay. How about this? How about this? And I'm purposely ignoring you. Just let me, I'm purposely not giving the right answers right now because I really need you at the end of the day to see what we should be doing. So which action is out of the scope of the LPN's practice for Mr. De La Cruz? So as part of being a nurse, you're going to work with other healthcare professionals. You're going to work with other healthcare professionals. And out of the healthcare professionals that you will be working with, you will have RNs, you'll have LPNs, you'll have nurses aides. You need to know them for NCLEX. So which action is out of the PN scope of practice for LPNs for Mr. De La Cruz? Select all that apply. Okay. A, assist the client with ambulation. B, give IV medications. C, administer PO medications. D, perform chest compressions during a cardiac event. Or E, evaluate the effectiveness of a medication. What do you say? We're looking for those that are out of the scope of practice for Mr. De La Cruz. Is it A, B, C, D, or E? It is going to be, I see it. Correct answer is going to be B and E. Yes, B and E. Very good, very good, very good. What about this? Which medication is most dangerous to Mr. De La Cruz? Which medication is most dangerous to Mr. De La Cruz? What would you say? Oh, yes, this is something that's very important. This is something that's very important for us to note. Okay. Correct answer is going to be the correct answer. Yep. Correct answer is going to be the ceftriaxone. The ceftriaxone is the most dangerous to Mr. De La Cruz. Why? Because remember, Mr. De La Cruz had the penicillin allergy. So this medication is the most dangerous to him. And these are the things that you have to see and be able to spotlight on your exam. Patients who are allergic to ceftriaxone are also probably allergic to penicillin. So you cannot give this for those patients. Okay? Now, I cannot stress it enough to you that you need to be getting training before you take the NCLEX. It is not something that is always common sense. And it does not matter how long you have been a nurse. You will waste a lot of money and you will waste a lot of time showing up for this exam not prepared. Just not prepared, okay? So we want to encourage you to get prepared. There were also many other mistakes on this electronic health record that you may have missed. I'll let you go back to it at your own time. I'm going to keep moving forward. But of course, there was that cross allergy to penicillin. This patient was ordered metformin and glipizide, but on the report and the information that you had, it clearly stated that this was a type 1 diabetic patient. Okay, so metformin and glipizide should have not been included in the medication. There is also no indication for warfarin for this patient. They should not have had it. The patient also did not have an order for oxygen. They needed it. Yes, this patient had anaphylactic shock. That what was going on with this patient. Very, very important for you to be able to see that. Now, I'm gonna ask this question. I want you to be brutally honest. I want you to be brutally honest. And that is, hey, were you a safe nurse today? Were you a safe nurse today? Just keep it real. Put it in the comments. Were you a safe nurse, or do you need more training? Okay. Question. People said, no, I wasn't. Do you want to study more? What about this question? Do you want to study more in the V2 to pass NCLEX? How about this one? Yes, everybody should be saying, yes, I want to learn more. Yes, I want to learn more. Well, the time is now to learn more, because this is a journey. The training is part of it, but also just the process to getting to the United States. So that is what I'm going to call up the experts for, because we're going to talk about the training, we're going to talk about the processing, but I do want to talk about the processing right now. Okay. So I'm going to ask my very able partner, Ma'am Raj, to come on in and explain to you the processing. So hi there.
Hi.
Hi, good evening.
Good evening, everyone. We are now at the time where they need to know about the processing. So I will allow you to tell them more. Tell them more. Everybody welcome Ma'am Raj to do that.
Okay, so good evening, everyone. Thank you, nurses, for joining us tonight. And I would like to take this opportunity as well to thank Ma'am Regina and Sir Mark, the whole ReMar team, for this amazing opportunity. Thank you for your big heart in helping Filipino nurses achieve their American dream. So, NCLEX. Okay, so AVA Processing is a sister company of NCLEX Unlimited. Uh, So why do you need us, or why do you need to process your NCLEX exam? Because you cannot take the NCLEX exam without processing your paper first. Given your busy schedules and as nurse, handling paperwork can be time consuming and stressful. That is why AVA Processing does the paperwork for you. So actually, we are a one-stop shop from your review to your NCLEX processing and even to your English language exam. Next. So these are the 4 states that we are processing. We are processing New York, Illinois, NMI, and Texas. So allow me to show to you a comparison of the 4 states. So each state has different time frames. They have the same different requirements. For New York, processing time frame is 4 to 6 months, as well as NMI. Illinois and Texas is 6 to 8 months, or even up to 1 year. For New York, it does not require work experience, same with NMI, but in Illinois and Texas, they require work experience. For New York, they don't require PRC license, as well as, but in Illinois, NMI, Texas, they require PRC license. NMI and New York, this does not require CGFNS and fingerprinting, while Illinois and Texas, they require CGFNS and fingerprinting. So New York is a single state, and application is valid until you pass, while Illinois and Texas, application is valid only for 1 year. So of all the 4 states, you can choose any of your desired 4 states, but majority of our nurses, they chose New York because it is more affordable, and requirements are too easy to comply, and the processing time is shorter compared to other states. So here are the documents that you need to prepare. I know you're all familiar with these documents or requirements. So you have transcript of records, related learning experience or RLE, college nursing diploma, high school diploma, birth certificate, marriage contract or certificate if married, passport ID copy, PRC ID copy, PRC board rating copy, and your certificate of passing. Okay. So here is our NCLEX application timeline. So I'll just show you the timeline so you'll be guided. If you will process with us, so our step one, we have your initial consultation. During this time, we will tell you what are the necessary steps, the requirements that you need to prepare, and we have your sign up fee. And after that, we have to process the form and also the contract signing. So you will be transparent in every transaction that you are dealing with. And then we'll proceed to credential evaluation. Credential evaluation is 1 to 2 months. This time we will process your school requirements. And after we process your school requirement, then we proceed to step 4, which is our application for your Board of Nursing requirements. And that will take 1 to 2 months. And after we receive your Board of Nursing notice, then we will apply for your eligibility and ATT. So this will take around 2 to 3 months. And then once we will receive your eligibility, you can now book your exam. And once we book your exam, then you will receive your exam day and we can avail for your quick result. So we advise that everyone will get the quick result so you will know if you pass or fail within 48 hours. So we also process NCLEX Australia. Next. And Canada. Okay, next.
Thank you, sir. Questions?
So
There's a question.
I will take this question. If I'm a graduating nursing, will take my PNLE in November, will be allowed to avail the package? Yes, you can avail the package, or you can choose New York because New York does not require PNLE or PRC license. So for the perks and benefits, if you sign with ABBA, we are a one-stop shop, so you don't need to go or shop around or other company or agency that will process, because if you choose NCLEX Unlimited and ReMar, so we are a complete package from your review to your NCLEX application. And we will advise that while having your review, you should start your processing. So timing is the essence. So you have to start your journey so you will have you can achieve your American dream. So that's all. And if you have questions, you can just visit our Facebook page, NCLEX Unlimited Online.
So I hope you guys see the importance and the benefit of having someone who is knowledgeable guide you through the process. Ma'am Raj, I know you've been doing this for some time. What is the biggest barrier to our nurses today getting started? What do they need to think about in order for them to act right now with their processing?
Mostly, they don't have time. They
Mm.
don't have time to go to their school and comply with the requirements. That's why we are here to help you. And also, they are afraid if they're on the right track or they're doing the right thing. So that's why We will lessen that anxiety, and we will lessen that task for you, so you can focus on your review.
Awesome. And what if somebody is watching and they're not sure if they are making the right choice, or they're not sure about the state that they want to apply to? Should they give you a call, or should they reach out to you even if they're not sure?
Yeah, we offer free consultation. We will give you advice of what state you going to process.
Awesome. 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 Thank you so much. I am so excited for people to know that we have this amazing partnership. And like you said, it's a one-stop shop. So you have your review, the two R's. You have your review, and then you have your recommendations, and then your process. So everything in one place. And if you want more information right now, go to www.nclexunlimited.com to find out more about all of the things that you get with this partnership as well. So not only ReMar, but NCLEX Unlimited, the dynamic duo. Okay. So we're going to get back into, actually, we're going to get into the opportunity in US nursing so that we can talk about it, so that when you contact Ma'am Raj, when you contact Sir Gary, you will have the right questions to ask. So we're going to get into this portion of our workbook. Now, when we talk about going to the United States, and what I'm asking you to do is just imagine being in total control of your nursing career. You know, in the United States, you don't have to wait around for somebody to say, oh, it's time for you to get paid. I'm here in Dubai right now, and I'm learning a lot about the nursing here in Dubai. One of the things is they get paid once a month. Okay. Now, this may be like your country, but in the United States, do you know we get paid every 2 weeks? Sometimes we get paid every week, and some nurses get paid even every day. And so just thinking about the ability to, boom, set your own pay schedule. That's just one of the differences in US nursing. Let me talk about more. I want to discuss another financial another financial positioning. In the United States, we're just going to talk numbers. We're going to talk about what a nurse makes in the Philippines versus what a nurse makes in the United States. And I probably can compare every country, but let's just start with the Philippines. So for a new graduate nurse in the Philippines, you're going to be starting off with a salary of 70 to 115 pesos per hour. Okay. Now, that same new graduate nurse in the United States is going to be making about $30 to $40 per hour. But I just kind of want to keep apples to apples here. So that would be 1,700 to 2,200 Philippine pesos per hour. Okay. Now, think about that. Just look at this difference. We're talking about 70 to 1,700. Big difference, right? And we can look at it and even go down for the nurse, entry level nurse, just a little bit more experience. You're going to be making 232 pesos per hour. You take that same nurse, you're going to be in the 2,000s, starting off at 2,200 to 3,400. All right. And we can do this all the way up to the highest level of nursing. Now, yes, this difference is, you can't ignore it. And not only can you not ignore it, you want to question, what am I worth to myself? Because guess what? The same diabetes that you're taking care of in the Philippines is the same diabetes you'll be taking care of in the United States. If you're delivering babies in the Philippines, you're going to be delivering babies in the United States. And so it is best for you to position yourself for success, because it's bigger than you. We're not trying to be a nurse just to survive. We want to be a nurse to succeed. We want to be the nurse that loves our career. I am a nurse that I love what I do. It is fulfilling to me. It's not easy, but I'm happy doing it. And that is what I want for you. I want for you to be happy with the decisions that you are making about your job in nursing. Okay. And I think this is an opportunity for you. You know, the biggest takeaway is this just this: a new U.S. graduate earns more than the highest paid Filipino nurse. And I'm talking about this nurse, and I've worked with nurses in the Philippines. This nurse has the most experience, the most training, the most knowledge, but she is going to be capped as far as her salary and her professional growth because of the location. So, what I'm asking you to do is consider being a global nurse. Consider being an international nurse. Okay. If you're in the United States and you're working 40 hours per week and you're making about $40 per hour, guess what? That is about $6,400 per month. If I switch that to Philippine pesos, that is 365,000 Filipino pesos per month. Imagine what that would do to change your life. And not only your life, but the life of your family. Okay? Your family. Huge, 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 huge. So, what we're offering you is, okay? What we're offering you is the opportunity to try something new, to walk through a new door, to experience professional growth and professional development with increased licensure. That is what we're offering you. Okay. And so I can provide you the training. I can give you amazing training, but my partners are here also to show you the quickest way to get there. Okay. So I'm going to introduce my partner to you, a man that has really planted a lot of seeds and now is able to see the fruits of his faithfulness and his wise decision. When you're building a team and you're building a successful career team, you want to have people that know how to make good decisions on your team. Even if you don't know how to make good decisions, you want somebody who knows how to make good decisions, and you will see that as evidence of their life. So I'm so happy to welcome to our broadcast again, Sir Gary Lou Ballatero, to talk to you today. Yes, the American
Yes.
dream.
Yes, hello. Thank you, Professor Regina. And once again, good evening to all our viewers all over the world, and especially to our nurses here in the Philippines. I'd like to take this opportunity as well to thank those who joined us in our nationwide tour caravan a couple of weeks ago. Those nurses who filled the seats of Baguio, Manila, Cebu, Cagayan de Oro, Davao, and Davao. So
Mm,
now, yeah, so this is our photo. So we have an amazing partnership with Team ReMar, Professor Regina and Sir Mark Callion. Now we're showing you the photos, those aspiring nurses who wanted to become U.S. registered nurse someday, with the earning potential of 365,000 per month, and probably an annual gross salary of 4 million. You know what I
mm,
truly believe is everything is about investment. So if you don't have the right investment, uh, you cannot achieve something in this life. So not everything in this life is free. So I'm talking about investment. I've been in the business for 25 years and I've done a lot of investment. I'm running 3 companies to date, and one of the brands that we are managing is NCLEX Unlimited Online under Avatar Virtual Academy. And later I will discuss to you what can it offer, and also with our cats. And a while ago, Ma'am Raj Lastimosa shared to you, showcased to you, Ava processing. So to God be all the glory. This uh, this partnership with ReMar has been really meaningful to all of us at NCLEX Unlimited for the last 8 years since the inception of NCLEX Unlimited in the Philippines. Yes, sir. Please, next slide. Okay. All right. So our NCLEX Unlimited online review program can offer you a wide array of various courses. When you log into our portal or to our dashboard, you can see a lot of courses that are in store for you, including of which the live Zoom classes, the recorded sessions, the replays, the final coaching, test taking strategies, and so on and so forth. Next. So this is how it's going to look like when you do your live Zoom sessions with us. So Zoom session is actually incorporated in our system. So you don't need to open up a Zoom application. So just go to our dashboard and then just follow through our schedule, where you can be directed to our live Zoom classes regularly. So our upcoming 38th live Zoom session is going to happen on May 15 up until June 15. So if you are not still our student, you can enroll in our package so you can participate in our live Zoom session. So on top of that, our NCLEX Unlimited offers you offers you an access to a wide array of ebooks, for more than 1,000 of ebooks and collections. So you don't have to download those materials from any other sources, because right here in our system, it is automatically available. So these are all the inclusions once you avail of our package under the NCLEX Unlimited online review program. You will get live Zoom classes. You will get replay after the live Zoom. You will also get uh, tons of videos, for 5 years of recorded videos. We have all of those ready for you in our system. And then, of course, our ebooks and handouts. You can check out our libraries, so you can fill in your time while you're still in the hospital, or you are working, or you're at home. Uh, you won't surely miss a review in your time. Next. Okay. So those are just a sample video. So next, sir. So introducing the newly partnership of NCLEX Unlimited and ReMar, combining the best of both worlds. And basically, this is a very rare opportunity for most of the time. So we are so thankful to Professor Regina and Sir Mark for this amazing partnership that we had earlier this year. And I'm thankful to God for what He has done for this company. And uh, ReMar is our answered prayer. So the Philippine market for the nurses has been suffering a lot due to retrogression, but thanks be to God, uh, the Lord has opened a new door for the nurses. All right. So we talk about this program further. So we have our cats, and on top of the NCLEX Unlimited, you can access our CATS, or computerized adaptive test system. This is the first in the Philippines, developed in the Philippines, exclusive for our NCLEX Unlimited students. We invested a lot for CATS, and I will not tell you how big is our investment for this CATS system, but it is like a real exam simulation, like Archer and New World. But then this is going to be for free for those who will enroll in our package. So under CATS, you will have 6,000 questions in our Q bank. SATA, drag and drop, name it, we have it all. New case studies for next generation, we have it there. You can also create a daily mock test of up to 100, more than 150 questions on a daily basis. You can create custom tests up to 50 questions daily. You can actually select a specific area of concept. For example, if you're having a difficult time for pharmacology, you can isolate all the questions for pharmacology, all 50 questions, pharmacology daily. And then it can provide you, the system can provide you rationalization for to advance your study and assessment. And then also the system can give you a feedback, a real-time feedback, to provide you a performance report or a cumulative report of your past and present examinations with CADS. And the best part is we have unlimited reset button. So this is unlimited. This is not just one time. This is unlimited. So you can reset all 6,000 questions over and over again until you finally get that wonderful experience and perfect NCLEX preparation. Next, sir. So there you go. That's your reset button at the bottom part of your dashboard. Next. So a while ago, Ms. Raj already discussed with you. So NCLEX Unlimited is packed with CATS and also packed with AVA processing. It's a one-stop unlimited program. So we offer you processing of NCLEX exam application, which was mentioned a while ago, including Texas, New York, Illinois, and NMI. We also provide school requisition and credential evaluation services for CGFNS and license endorsement. Right. And on top of that, since we are also the owner of 9.0 Niner IELTS Review Center in Visayas and Mindanao, so we are giving away our student free language review or English language review for those who will avail our ultimate package. Go on, sir. So we also have our branches located in Cagayan de Oro, in Cebu, and in Davao. And we also do our processing. Next. So should you wish to take your examination, whether it will be on paper or computer, for either British Council or IDP, we also assist you in processing your IELTS examination. Or should you wish to take PTE, TOEFL, TOEIC, or MET exam preparation, exam application, we can also help you process that. Okay. So this is the part where ReMar is going to be included in the package. That we are highlighting later on. So with the partnership of NCLEX Unlimited and ReMar, you get 6 months subscription from ReMar package. And this is exclusive only to our enrollees from the Philippines. Because if you will go to a ReMar, they're only offering 3 months subscription. But here, since we have this exclusive partnership, so the offer is being extended up to 6 months with the same price. So once you paid for the review, you also get to activate ReMar V2. So the inclusion of ReMar V2, it's a different learning management system provided by ReMar. So you're going to have your ReMar V2 training course, which was Professor Regina made a sample a while ago, how it's going to look like. And they also have 4,000 Q bank. Imagine that, 4,000 Q bank, 75 case studies, two CAT exams. So you combine that with our CATs and NCLEX Unlimited CATs, you get 10,000 questions to practice with. Ewan ko na lang kung hindi pa kayo pumasa. All right. So on top of that, you will also get an actual book of quick facts for NCLEX and the NCLEX Virtual Trainer V2. This is a hard copy. So if you are from the Philippines, so once you purchase our program, we can ship this the books to you to your address for free. Or if you are within the location of Cebu City, Cagayan de Oro, and Davao, just visit our branches. So if should you wish to enroll, please feel free to visit our website at www.nclexunlimited.com, or you can visit our Facebook page at NCLEX Unlimited Online. So you can freely ask questions there or inquire further for the packages. All right, so that's our website. So I think there's something wrong with this. Okay, can you move it, sir, oh, no, no. Go back, go back. All right, so the yellow box here is, I think this is just misplaced in this PowerPoint, but it's actually pointing out to package 3, which is I highly recommend for you to take, because package 3 is our ultimate package. It's our US Express package. uh, it's actually from 20,000 pesos, and we're still giving you a 20% discount. So this has been extended since we have our nationwide tour a couple of weeks ago. So this has been extended up until this day. So that's a 20% discount. From 20,000 pesos, we're offering it to you 16,000 pesos. So what you get from this package is you get ReMar V2. You will also get NCLEX Unlimited. Uh, there you go. So this one, you get NCLEX Unlimited, you get ReMar V2, you get CATS for 1 year subscription, you get free processing for AVA processing if you are planning to take your board of nursing for New York, Texas, Illinois, or NMI. We will assist you for free. Okay, we will assist you for free if you will avail our 16,000 pesos package, package 2. So and then on top of that, you can you can you can choose either IELTS, PTE, TOEFL, or TOEIC right after you pass your NCLEX exam, because we are too the owner of Niner, and we can give it to you for free, and we can help you and assist you in taking your IELTS examination. So it's going to be a one-stop unlimited for all of you. I'm sure you're going to enjoy it. A lot of students have already enrolled in our packages from Baguio, Cebu, Cagayan de Oro, Davao, Metro Manila, and I hope you will also avail this once in a lifetime opportunity. So should you wish to visit any of our branches are located in Cagayan de Oro. We are located in Gomez Rizal Street. We are just at the back of GiftMate. Okay, so we have two offices in Cagayan de Oro, one in this area, and the other one is in Octagon Building, along Veles Street, almost fronting BPI. So we are also the operator of a 9.0 and IDP computer testing hub in Cagayan de Oro City. So check that out if you wanted to have your IELTS or MET exam on this specific testing laboratory. So if you are in Davao, please feel free to visit us at CM Recto Street at second floor, Knights of Columbus building. This is actually near Cathedral, okay, near San Pedro Street. Okay, next. So if you are in Cebu, we are near Osmeña Boulevard, Osmeña Rotonda. Okay, so that is actually going to Chongwa, Kananga Road, no? So just locate that building, the Phil Trust building. We are located at the third floor. So follow the guide there. You will see our classroom and office for NCLEX Unlimited and ReMar. So once again, I invite you to invest okay, to invest. If you want to earn in the future, invest at the right investment. So this is going to be your right investment. 16,000 pesos as compared to 4 million income annually. You should do it. I have invested so much in my companies, and my companies have grown in the last 25 years to multiple companies. And I truly believe in investment. All right. So uh, I want you all to know that you cannot do this by yourself. Don't do it. Don't try it by yourself. Take God with you. Ask God to guide you. And may the Lord God be with you always in this journey, because I'm sure the Lord will establish your steps. And that this is exactly the reason why the Lord God made you a nurse. So the moment He sent you to the United States, you can also do your part in expanding His kingdom. If you believe in the Lord Jesus Christ, if you're a follower of the Lord, if you're a follower of the King, if you are a follower of a Savior, go and tell your patients about Him, because this is your ultimate purpose why you are going to be sent in the United States. So that's all, and I hope you will enjoy for the rest of this evening. God bless.
Wow. Thank you. What great words, and what a great reminder of our ultimate purpose as we are making plans for what our life will be like and the places we go. Let us not forget that only what we do for Christ lasts. And so we must also align our lives with His ultimate plan of salvation for all who believe that Jesus Christ died for your sins. So, great, great, great. We had an amazing class. I hope you were able to fill our hearts and how we have really prepared all this for you. We did all of this so that you can show up and hear about this amazing opportunity to, boom, expand your life and your nursing career in a new place, So, as a nurse from the United States, I will say very confidently, we love nurses from the Philippines, and you will find so many people who have already made the journey. And so there's no reason why you cannot join them. And as our partnership, as we are learning, we're here to be a one-stop shop for everything that you need in order for that journey to take place. So from ReMar Review, and I am sure as well from NCLEX Unlimited, Ava Processing, and all of the conglomerate that you now have at your fingertips. We want to say thank you so much for joining us. And we hope to see you. God bless you. We hope to see you at our next event. I hope to see you at our next event. See you later. Have a great evening. Bye-bye.
Y'all, bye. Thank you, Mama Regina.
Thank
God
you,
bless.
sir.
God bless.
God bless you.